Welcome back to Get Your Man On. We have Justin Turner with us. Yes, he's back. I just had to make a change. There was too much good stuff going on. Had to bring it back. We have more questions. There's more treatments for ED and all that stuff that we just need to get into. We're just going to do this. We're living on the edge here at getyourmanon.com, which you can go to ask us a question. Click that big button in the middle of the page and give it to us. We're going to talk about it right here. Justin, thanks for taking the extra time. There's a few more treatments for ED that we really should talk about. So we talked about Viagra, Cialis, Levitra. We talked about the sublingual form, which is really cool. We talked about Trimix, which that's the gold standard of ED treatment according to the American Urological Association.
Yeah, no, absolutely. They use that term.
Yeah, that's pretty cool. And I love that. Love for every guy to try that that's medically qualified for it. Sounds like a grand adventure for sure. What other treatments are there out there for ED?
So once we get past the injections, you're starting to get to the mechanical devices, vacuum constriction device, which is a penis pump that most of us kind of Austin Powers gives us that reference there.
It's not mine, baby.
Yeah, absolutely.
It's not mine.
You place the penis in it, vacuum, negative pressure. It's very, very good at giving you an erection. The issue is if you just take it off or deflate it, it just kind of goes down. So there are a ring on the back that slides and holds the blood into the penis. And some guys do really well with that. Some guys don't. But most definitely an option, very sound, solid option. Then you get to surgical implant, prosthesis.
Did you just say we use a vacuum?
We use a vacuum, yes.
So, like, I have a Swiffer at home right now, but there's a couple other different types of vacuum. Like, what kind of vacuum are we talking about here?
We're talking about a medically cleared device, glass cylinder. Again, it's a very founded, very old treatment there. Some of them are battery powered now, so they are getting a little bit fancier for sure.
Are those the ones that show up on the doorstep, like the salesmen that sell those aren't?
No, you're going down the wrong path, Evan.
All right, so we got a vacuum device.
Yep, and then we have prosthesis or implant, which is a surgical procedure that can be a great option for some guys, but it is a end of the road. It's going to change the physical components of the penis. They literally rot out the muscle and the tissue that's there and put in an inflatable device. There's older semi-rigid devices they can use also.
Wait. You put in an inflatable device.
Inflatable device, yeah. Very
a rigid device. Can we talk a little more about that?
Absolutely. So, the penis is made up of three muscles or chambers. The corpus cavernosum, or what fills with blood that we referenced earlier. They actually hollow those areas out and put in an inflatable device. If you think about like a silicone bag filled with saline, and so they actually insert those into the two chambers of the penis. They put a reservoir holding the silicone reservoir holding the saline, normally behind the pelvic bone, but somewhere in the body. And then they put a pump device, sometimes in the scrotum, sometimes other places.
A pump in the scrotum?
Yeah, absolutely.
You're telling me I could have a third testicle?
You absolutely could have a third testicle. But when guys want to have sex, they reach down and they pump that device. It takes the fluid from that reservoir and pumps it into those silicones, very similar to filling up a water balloon, giving a guy an erection. And so, again, going to completely change the state. Most definitely need to evaluate all your options before you go down that path, but it is most definitely the right option for some guys.
Can it pop?
Yes. It can absolutely rupture.
Like during sex?
Yeah, I guess it could during sex for sure. The devices fail like any other medical device. They most definitely can fail. I wouldn't consider that to be that abnormal for that procedure. The consequences, they have to remove it and put in another one, and that's a lot to ask a guy to walk through. The devices have came a long way, and so they've gotten better. I will tell you that, again, it's not a normal erection. It typically will make the two corpus cavernosa, the chambers of the penis rigid. It doesn't the glands, the tissue that makes up the head of the penis.
The tip?
The tip, yes. It doesn't fill that with blood, so sometimes that remains soft. And so It is most definitely different, but again, we're talking about guys that are faced with no other options.
Can they still ejaculate?
Yeah, absolutely.
Yeah. Is that a natural feeling, or is it like swimming through, water balloons?
No, so the ejaculatory process happens through the urethra, which is still intact, and so that process would be normal.
Gotcha. Wow. Okay, that's amazing.
Yeah.
What else we got?
We got some after that. Those are the main, first line, second line, third line kind of mainstay treatments with lots of medical data. After that, you get to kind of what I would consider alternative therapy. That's where the biggest one now is the acoustic wave therapy, a technology that's been out for a decade now, starting to get some attention in the States for sure, but it's where we take acoustic waves and drive them in the penis. We do that because those acoustic waves, in theory, or the science behind it, is we believe that they stimulate the blood vessels to tell the body that it needs to repair itself. And so in theory or science, we believe it increases blood flow. But what it's been proven to do is raise erectile dysfunction scores by 6 to 9 points, which is a big deal. That erectile dysfunction scale, something we call a SHIM scale, goes from 0 to 25. 25 is perfect. 0 is it's not going to work really no matter what we do. 6 would be the realm of where I was talking to an injection patient. A 10 or 11 would be an injection patient where he's going to get really good results, and maybe pills work half the time. And then an 18 or 19 is where pills are working really well. So raising a guy 6 to 9 points is a big deal. Is it a cure for erectile dysfunction? Where'd you start? Like that's the answer that unfortunately some people that are advertising it aren't making very clear. When I meet a guy who's had prostate cancer, had his prostate removed, has a severe erectile dysfunction, and he's sitting at a 0 to 5, this procedure is not going to allow him to have spontaneous sex. It's just not. If I meet a guy who's 46 in really good shape, when he tries to have sex 10 times, 8 out of 10 times, he's pretty good. There's a chance that guy could get drug-free, every guy I've ever done it on has had positive benefits. I believe all guys can benefit. It's just the reality, is it going to get you off all drugs? The answer to that is not for all cases. Sometimes it does. Most of the time, it's about improving the outcome of the medications that are already proven and used through those tiers we just went through.
Man, so it sounds like there's quite a few options that need to be discussed with a provider. What would you say to a guy who's maybe nervous about coming in? Like, again, we're on a mission to eliminate the stigma. How do you get us over the hump there?
Just telling guys how common it is. The worst prognosis in sexual function is how long has it been since you had sex. And so 1 year turns into 18 months, turns into 2 years. You're running the risk of not ever regaining sexual function. Best prognosis, again, when was the last time you had sex? The sooner you step in, the sooner you intervene, even if it does require a medication, the better off you'll be. Confidence has so much to do with this, and it's just difficult to be confident when you can't perform.
Yeah. What's the longest you've seen success? Like, how long? What's the patient with the longest length of erectile dysfunction that you've seen success with?
There's a long list of guys that were over a decade that we returned sexual function to.
Over a decade.
Absolutely. So, again, if their blood vessels are healthy enough to work, we can get them to work.
Let's go. That sounds like hope right there, baby. Let's get you taken care of. And if it's a wife, what would you say to tell your husband?
Get him in. Call. Make the appointment for him.
Make it for him. Come in with him.
Absolutely. Come in with him. Keep him honest. We'll get to the bottom of it, and we'll help him out, and both of you will benefit from it.
Justin, thank you so much for being a guest. Let's talk to you again next week, and let's talk about testosterone.
Absolutely.
Will it make me Arnold Schwarzenegger?